A lot of abuse, walking, jumping, running.
High heels. That's what I thought exactly before I put on my high heels this morning. I'm wearing the stilettos that I never wear.
Oh my God, you really are.
I really am, I know. Dr. Amy Bruce from Orthopedic Surgical Partners is here this morning with some ways to help eliminate pain and keep us moving.
How are
Dr.
ya?
Bruce.
Good morning, guys.
Good
How are
to
you
see
guys
you.
doing this morning?
We're excellent.
Ask me in an hour after I see how I do with the stilettos.
I'm wearing my flats today, Doc, so we're pretty good.
He's being a good boy.
So we're talking about all things feet today, especially bunions.
Yes.
Well, I don't even know what a bunion is.
Yeah, so a bunion is actually not a simple bump, which I think a lot of people think.
Okay.
A bunion is actually a structural complex deformity that starts when your big toe, so that's your great toe, starts to shift outward towards your smaller toes. And then there's a bone behind that big toe called your first metatarsal.
I think I know exactly which bone you're talking about.
And that bone shifts inward, so they're going in opposite directions. And then what you notice develop is an actual bump on the inside due to that change in position. So it's a little bit more complex than a simple bump.
And so what causes the shift? Is it age? Is it genetics?
Great question. So there are a number of causes of bunions. Commonly, we see about 70% of people who have bunions report a family history.
Oh, okay.
So there is a hereditary component to bunions. In addition, not only do bunions run in the family, but people also have the foot type that will develop a bunion. And what that means is, have you heard of fallen arches or flatter feet?
Yes, I have that.
So someone with a flatter foot has a propensity to develop a bunion.
I have this strong urge, doctor, to show you my feet on TV.
I know.
It's just so weird. I'm like, I just want to show you my feet.
It's interesting, you know, and not everyone is a foot doctor, you know. I think with feet, sometimes people get a little, they're embarrassed or a little apprehensive, you know,
Yes,
but you see all kinds of cases.
All kinds of cases, all different types of foot injuries and deformities, and they all require a really personalized approach to addressing it.
What are some of those approaches?
So specifically with bunions, it's important to know that a bunion is a progressive deformity. That means that over time, it will usually get worse. We can't really address it with only doing conservative treatment because that won't change the actual structure. And by conservative treatment, I mean using toe pads or toe spacers or padding the bump, which can be really painful. So if we want to really address the actual structural deformity, we talk about surgical treatment. And that can come in different forms. There's probably about 100 different bunion procedures out there. So it's really, really important to look for a foot and ankle specialist like myself and really have that conversation about the type of bunion procedure that may be best for you.
What is considered downtime for a bunion procedure?
Great question. So it depends on the procedure you have done. So that can range from walking the same day to using a protective boot or mobilization shoe for about 6 weeks.
Okay.
You are not bedbound.
Okay,
I think there's a misconception that you are bedbound. You cannot walk for a long time. That was more seen traditionally with older bunion procedures that were done. But now we want people to be active early with early mobility and range of motion.
So this is more of an outpatient procedure,
Absolutely,
right?
absolutely.
And, you know, for those, say someone's in their 30s and they discover that, you know, they are starting to have the beginning of a bunion. Is it a situation where you want to get in and correct it as soon as possible with surgery, or do you kind of just give it some time?
Great question. So I think a lot of people will have a bunion, but it may not be as painful right away. What's important is to have it evaluated by a specialist. And what we will do is we'll talk about kind of what we think it's going to do over time. And I do think that if you address them early on, you'll have more options. The procedures may not be as extensive. If you lose that window of opportunity to have them addressed early on, it may be a little bit more limited about what you can do down the road. Or you may not be able to, especially with age as a factor, your mobility may be minimized the older you get. So if you get to these a little earlier, you'll have a little bit easier recovery for most people.
This might be the dumbest question you've ever heard, but if I'm right-handed, am I going to get a bunion on my right foot?
Not necessarily, but some people...
It's an equal opportunity foot thing?
Interestingly, some people will only have a bunion on one foot versus on both feet.
Isn't that fascinating?
Yes.
So it's not your dominant foot? Is that what you were getting at?
Not necessarily. Sometimes we will also see a bunion develop if you've had trauma. So we're talking about football players, soccer players.
And this could be something that happened when you were younger that kind of develops over time. You don't even realize it, right?
Exactly. If there's a traumatic injury to your big toe joint from running suddenly or a sudden sprint, you can injure those ligaments around that joint, and down the road you can develop a bunion.
Yeah, I used to walk on my feet, so I don't think that that's good for you, right, Doc?
You used to just walk on your feet?
Yeah, I can still walk on my feet. No, like on my toes, I mean. I can walk on my toes.
I was going to say, we all walk. Yes, that's good.
I have a doctor in front of me, and I'm telling her I can walk on my feet. I can walk on my toes.
Why did you I'm so interested in your path. You chose feet as a specialist. Why did you choose feet?
So I always kind of knew, and I was drawn to medicine early on.
Yeah.
However, after sustaining my own injuries, specifically with my feet playing tennis, when you injure your foot, you know how important it is to get them back on track.
Yeah. You gotta be proactive.
You really do, and your feet are what carries you around in life.
Yeah. So you can walk on them.
It's really critical to focus on your feet.
As a foot doctor, you've got a lot of soul, so we appreciate you coming in.
Thank you so much for having me.
Good to see you.
We are on the heels of something really exciting to tell you right now. Orthopedic Surgical Partners, OSPCT.com or 401-787-8035. Thank you, Dr. Bruce.
Thank you so much. You were a delight. Please come back.
Definitely.
All right.